Hi, Ms. Smith. It looks like you're bringing in Johnny for a stuttering assessment today. I'd like to begin by just giving you a little bit of information regarding what we know about stuttering and also what we don't know. Regarding the onset of stuttering, or in other words, when the stutter tends to begin, that's a difficult thing to study. We don't have a lot of solid, we don't have a really solid idea of when it tends to develop across all different kinds of kids because it's just a very difficult thing to study. But we do know that if a child is going to stutter, the likelihood that they'll begin stuttering between age 2 and 4 is relatively great. In other words, between 2 years old and 4 years old is typically when stuttering does tend to develop. After age 4, it is the likelihood that they're going to stutter drops off rather dramatically. Um, so after age 4, much less likely that it will develop. The onset can be gradual. In other words, they can slowly develop a stutter, and it can get worse over time, or it can be just a rapid onset where one day they're not stuttering and they wake up one day and just the stutter is clear and pronounced and it's persistent and it's there. On that note, of onset, there's kind of after the onset, there's two different paths that a stutter can kind of take. We can go on the recovery path, or we can go down the persistence path. One path is where the child sort of just recovers naturally without any formal intervention, and the other is where the stutter does persist and get worse. What we know about those two paths, if a child is going to recover, it's likely that they're going to do so within 3 years of onset. So once the stutter starts, 3 years after that, most kids recover within those 3 years, and even more than that, most kids tend to recover if they're going to naturally within 12 to 18 months. This isn't to say that recovery isn't possible after 3 years, but certainly the majority of those who will recover do so within that amount of time. There tends to be a gradual decrease in the frequency and the severity of the stuttering. Um, uh, Even then, the recovery path is going to kind of look like a bit of a roller coaster. There's going to be good days and there's going to be bad days. The stuttering is going to be really, really bad, and then it's going to be really, really good, and it just kind of goes like this over time. But overall, the trend, if we looked at it globally, we're going to see a trend of the stutter just sort of over time decreasing. Um, Other path, much less pleasant, admittedly, is the path to persistence. This is going to be something that's more likely after age 4. After age 4, they're going to be much more likely that the stutter persists. It's also going to uh, basically just the disfluencies become more frequent and more noticeable. There's less of a roller coaster type of a thing, and it's more just where the stuttering just gets more pronounced and more severe as time goes on. Along with the stuttering increase, we also see that secondary behaviors tend to come along with it. In other words, facial tension, just avoidance of certain situations, um, the stress and the anxiety that comes with the judgment that they feel because of the stutter. All those things are likely to come along with the stutter, basically just emotional reactions and secondary behaviors accompany the increase of the stutter. It can also be and is likely to be more context dependent. So there's going to be certain sounds, certain words, certain situations that your child knows are likely to cause a stutter, and because they know that, they're likely to just avoid those situations entirely. And ironically, the more, or sadly, I guess I should say, the more stress and anxiety that they feel about the stutter, the worse the stutter gets. Um, Unfortunate, but very, very true. Um, I want to also say that a lot of this stuff is what I should say, whether they go down the path to recovery or whether they go down the path of persistence, We have some risk factors that we know will steer them in one direction or the other. Risk factors for it being persistent are, if your child is male, biological males are just more likely to develop and continue a stutter. Heredity also plays a large role in it. If there's someone along your family line that has had a stutter, it is more likely that your child will also develop one. If there's been a long length of time since the onset, in other words, let's say you notice the stutter develop around age 3 and it persists 12 months, 18 months, 2 years, something like that afterwards. In other words, the likelihood that it will persist rises along with the length of time that they've had it since it developed. um, with all of this said, it's difficult to predict whether or not your child is going to persist with the stutter, or whether they're going to recover kind of naturally from the stutter. And we know that not only is a stutter difficult for the person who stutters to deal with, obviously the predominant stress is on your child, because he's the one that's dealing with it, but we know it's also hard for you guys because you're watching your child go through something that's incredibly painful and anxiety producing for them, and there's not really much that you can do. And I know for me as a parent, the worst possible situation for me is when I know my child is suffering and my hands are tied and there's nothing I can do. We know full well how hard this is, both for you and and his other caretakers to deal with, as well as himself. Worst case scenario, if this is something that persists and we notice it getting worse, we do have a lot of tricks up our sleeve, so to say, interventions that we can do, therapy modalities that we can pursue that will help him feel less ostracized and feel less severe, or feel less cut off because of the stutter. It's not to say that if he does go down the path of persistence, it's not to say that it'll ever necessarily go away. But our goal here is to get him to be able to live a full and completely normal, completely full and joyful life, whether he stutters or whether he doesn't. And we've got a lot of tools in our toolbox that we can use if the stutter does indeed persist. With that said, if you have any questions, comments, concerns at all, don't hesitate to reach out to us. Thank you so much.